Hi all, this is Dr. RESIN. Thank you Dr. This for inviting me. So regarding my UPSC CMS interview which happened almost 5 years back. So it was the first time when I appeared before an interview panel. As far as our UPSC CMS interviews are concerned, the panel will be formed of 4 members. 3 will be doctors usually, and the panel head will be belonging to either All India Service or a Central Civil Service. So he will be the head and he or she will be the head, and they will be starting the interview. So for me, sir started by asking with respect to my surname. My surname is Kabir. So they asked me regarding the poet Kabir Das and asked me to recite any of the poem or the doha of Kabir Das. And secondly, what was the importance of Kabir Das other than as a poet? The answer was he was a social reformer. Then sir asked me regarding the different what are the different type of communicable disease as well as non-communicable disease prevalent in the state of Kerala. As I belongs to Kerala only. And they asked me which is the non-communicable disease for which Kerala is known for. It is diabetes, because Kerala is known as the diabetic capital of India. Then coming to surgeon, surgeon asked me regarding the esophageal cancer. Esophageal cancer, he has given me a clinical scenario. What are the differential diagnosis of that particular scenario? How you will be coming to this particular diagnosis, and what are the management option? Then gynecologist madam asked me regarding the whole thing regarding postpartum hemorrhage, starting from how a patient will be coming to labor room with the symptoms of PPH, how can we diagnose, how can we manage, and what are the different stages or different options for management. Then ENT surgeon, sir asked me regarding the types of ear discharge like serous, mucus, mucopurulent, blood stain, etc., and how it will be helping in differentiating different type of diseases of ear. And lastly, I have one tip for you. Like, suppose if you people are stuck with a question, or if you don't know the answer to any of the question, don't get panic, don't waste your time. Just you inform the panel that you don't know the answer, so you can go to another question. So it will be helping you to get more chances and more questions. So that's all. Thank you and wishing you all the best.
Good morning everyone. Myself Dr. SANJEEV from GMC Chandigarh. But I wanted to share with you the questions which were asked to me in the UPSC Cms interview. The questions related are mostly to your clinical postings. So whatever you do in your clinical postings, they will ask the questions of every field. From the medicine field, the questions are asked to me the management of the DKA, the methodology of inserting, to what length you insert the health tube or its color coding, okay, that you learn while doing your clinical postings. In neonatology, they mostly ask for the registration programs, the latest guidelines, all about the umbilical vein catheterization or the EMBO-VAG, means whatever it's about neonatology resuscitation. Milestones are very rare. They mostly ask in the written exam, which is theoretical part, or in the interview. In the surgical field, they will ask you about the different cases of pancreatitis, presentation, appendicitis, or the management. Means mostly about emergency postings. Diabetes and HIV has been always an important topic. TB has been an important topic. In SPM, they will ask different activities you participated in. World Health Day, theme of the World Health Day, when it is celebrated, World TB Day. Means like I participated in the World 24th March World TB Day. What health activity was conducted in our college. So most of the time I went on the TV program also, or its present curriculum or present status of that program, means how effective it is. In the Upsc Gynae, it was the question asked to be about the preeclampsia management, what drugs we give in there, and the more they will ask you, IAS officer, he asked me about my ectophobia activities, and he correlated that with the health, like what medical first aid kit you will carry while traveling with you, or which medications are kind of essential or basic medicines that you're going to carry with you. In respect of that, they will ask you the basic definitions of the health, hospital, what do you mean by health, take care, what do you mean by the hospital. I was asked that what for you is a hospital. define just in your words. Or they will ask you if you have any craze for a particular branch, if you have any craze about ops, gynae, radiology, surgery, why cricket you wanted to take it, or related questions to that. Like I asked about radiology, so they asked me about the TFA scan or the latest ultrasound guidelines that are coming up. Well, different e-fast, what's the difference between the e-fast and the fast, or the newer methodologies or the newer inventions or the latest thing that's occurring in that field. So be well versed with all those questions. Mostly they are all from your clinical postings, so don't worry. And just the most important thing was during interview was your self-confidence. If you don't know any question, just pass it or say sorry. But just don't stop. Be confident while answering your questions. Be in a flow. Thank you. Thank you so much.